So yeah, and the next question was, can the two occur together? Can autism and ADHD occur together?
Yes, definitely they can occur together. In fact, the CDC say that 14% of autism occurs with autism, interestingly. And you know that with these conditions, because the symptoms overlap, sometimes it's difficult to know whether you're looking at just ADHD or just autism or a mix of both, but they can and they do occur together very frequently.
Okay. Right. Then the next was what is the difference in the developmental delay? Like ADHD, does it have certain delays in milestones that do not occur in autism, or are the developmental delays the same?
They're different. They're different. They're very, very different. With autism, the developmental delays are more, it's easier to pinpoint it. You can easily just pinpoint. I'll use an example of speech. We know that children start to talk at, around 18 months. This child should be saying mama, dada, leta, kuja, simple words that they hear all over every single day. Stop, take, give. They hear that and they can follow through with those instructions. We know that by the time a child is around 4 to 5 months, they keep eye contact, they smile at you, they experience separation anxiety. When mommy leaves, they'd be very keen that mommy has gone, and sometimes when you have to go to work, you have to play hide and seek. And the whole day they'll keep on thinking that you're in the next room, kumbe you left long time. Yeah, and then when you come back, they're like, oh yeah, hiya, this person actually left. Oh, okay. So those delays or those pointers are very visible. For ADHD, some of the delays may not be visible, and for some people they don't have delays per se. Again, I will emphasize with neurodevelopmental conditions, it is noticeable when you're put in an environment that puts your capacities at great levels of strain. So for a child who has ADHD, you'd start to pick up the signs around age 5, age 6. For autism, you can pick up the signs way earlier. So for a child who has ADHD, the reason I say age 5, age 6 is it's when that time where parents start to take their children to play school, and you expect your child, because you've taken them to nursery 1 or PP1 or year 1 or play date or whatever name is called in the institution, that this child can be able to manage themselves adequately in an environment that has many other kids. But then you find that your child may not be able to do that. They may not be able to sit in class for a whole 40 minutes and concentrate on kama tent, like a tent, B has a tummy, B has 2 tummies. Like, it's so boring. It's very boring, especially if it's repeated every day. By the time 40 minutes has elapsed, this child is bored to death. So they may start playing around and fidgeting in class and causing a bit of havoc, throwing a paper plane here, taking out their snacks to eat. They want to go to the bathroom, they can't go and tell the teacher, please may go. So for them, it's just easy to just walk out. I mean, I know where the bathroom is.
So I don't need to tell you.
Yeah, so there's that whole aspect of zoning out in class, causing a bit of trouble in class. The same also would apply in a church. Same things would also note at home. Same things you'd also note with their primary caregiver. So this would be the nanny. The nanny would keep on complaining that this one, I tell them to, do their homework and they can't stop playing until it's really dark. So those are some of the delays, if we may call them, that occur in a child who has ADHD. The reason I'm putting it in quotes is because it's easy to just say that if the child does that, but then it becomes a problem when this child does this way into age 12. So at around age 12, that's when a formal diagnosis is made, although we can and make diagnosis of ADHD from as early as 6 years. But with the DSM, it's very clear. The DSM is the Diagnostic Statistical Manual of Mental Illnesses. It will say at around age 12, because there it's very concise. This is a kid who's going to Form 1. So if you're going to Form 1 and you still forget your books in school, you still say that my homework is at home, then there is a bit of difficulty there.
Okay. Is there a way to improve the attention of this child? What can someone do?
Okay, there are many ways that which you can improve, not the attention per se. I won't limit it to that, because that would be a very big disservice to ADHD as a condition. Is there a way that you can improve ADHD symptoms? I'll broaden it to that, because ADHD comes with so many symptoms that which some are not captured even by the DSM. Some of you who have children who have ADHD or who are adults with ADHD will say, okay, well, I have ADHD, my issue is just not attention, or maybe I can't pay attention. So what do you mean? Because you'll notice also with ADHD, if the person is very interested in what they do, if they're passionate about it, then they will focus on it for hours on end and not stop, and you can't stop them. But then if they're not interested in it, it doesn't matter how interesting it is, the attention will just flee. So I'll come back to the question and just broaden it to, is there a way that you can improve the symptoms of ADHD? Yes. So there are a number of avenues, one of which is through the use of medication, medical intervention. Again, bearing in mind that ADHD occurs in a spectrum of mild, moderate, and severe. So depending on the severity of the condition, you may need to be put on something to help with these particular symptoms. And the choice of treatment would be dependent on the symptoms that you have. Okay. Also, dietary factors do help quite significantly, especially omega-3 rich foods rich in zinc, magnesium. This would be healthy fats, your avocados, your nuts, limiting your processed carbohydrates. These things that we love and enjoy, like pizza, you just limit it, and you stick to the good old ngwashi and dumas, the arrowroots, sweet potatoes, those kinds of things do help. For some people, cutting down on sugar may help, especially the hyperactivity. For teens and those children who have ADHD who are moving a little bit more into adulthood, cutting down on coffee and caffeinated drinks help quite a bit. Also, there's therapy, and with therapy I'm talking about cognitive behavioral therapies in general. They help with, number one, self-awareness. They help you understand how your brain functions. They help you understand when your symptoms are coming up. They help you understand what to do, what's the trigger, things like that. Behavioral therapies are really good as well, because they also help you pattern yourself. They help you get organized. So all of these things are good techniques. Use of physical exercises, especially for the people who struggle quite a lot with attention things. You'll notice once you have a nice time at the playing field, then all the energy, the excess energy is released there. And when this person goes into work, they're able to sit down and focus. So physical energy, I cannot emphasize about that, enough. And then just trying to come up with more supportive ways for especially the parents to be aware and cognizant of their children and how their children operate. The reason that is important is because social support is key, and with ADHD you require quite a bit of that external support and structural systems.
Okay, and I was reading an article that was saying that another way of improving the symptoms is limiting the child screen time if they are below 5. Is it true or?
Yes. Limiting the screen time is really good, especially just before sleeping time, because you see, the way an ADHD mind works is not the same as the way a neurotypical mind works. And the mind of someone who has ADHD, it's very active inside. So if this person is going to be on the TV, there's a lot of stimulation going on, both auditory as well as visual. So that creates quite a lot of activity in the brain. Now, if you're anticipating that as a family you're going to sit and watch maybe SpongeBob, then you go to bed, because this child has been on the screen for that significant amount of time, getting them to now wind down and sleep will be a bit more difficult for them. Not that they're trying to be troublesome, not in the least bit, but because it takes time before they can now shut down and wind off, and whereas for you, you'll just hit the lights out and you're out. Yeah. But then again, it depends. There's a part where it depends. I know we're in the era and age where many of us, use gadgets even for education purposes. So even as you expose your child to educative material on screen, try to have proper breaks in between, and that they don't use these gadgets, especially when it's about time for them to be winding down. Also creating space for them to do the traditional pen paper thing. That way it sticks more.
All right. Then a parent wanted to know, if you can give a scenario of someone who you've interacted with that has become an adult who has ADHD, and do the symptoms get better with time, or what's your observation like?
Okay. Now, traditionally, ADHD was taken to be a child disorder, but that is not the case. ADHD is a neurodevelopmental disorder, which means it can and does continue into adulthood very commonly. So I interact mostly with adults, and there's quite a number of adults who have ADHD. Sometimes, interestingly, the parents will get the diagnosis of ADHD, and then after they get the diagnosis of ADHD, they go like, but my child does that, and they used to do that when I was a kid. So then now they take the child for an evaluation, and then now the child gets a diagnosis. So it's a very interesting dynamic, I find. With ADHD, I'm going to zero in on it because the question seems to be very particular about it, is that these symptoms are not static. They change as you grow. Okay, so they change with societal expectations, they change with the environment, they change with every single aspect of development. And what a child will generally present with as symptoms is not what you'll find in an adult. Does it get better with time? Yes and no, depending on the environment where the person exists. So in an environment where maybe this child, the parent understood them and worked with them and, was very appreciative of what was going on with them. The teachers were also very encouraging, and there was a lot of warmth and understanding. Then the symptoms still present in adulthood, but are not as intense. More so the hyperactivity dwindles down a bit and becomes more an internal struggle. So this would be a person who's overly anxious. They look as though they have mood swings where they get depressed. Yeah. Whereas the adults now would be a bit more anxious, a little bit more moody, and the mood swings would not meet the traditional depression kind of thing. It's like in the morning, you wake up and then you're late and then you're in traffic and then you hit the office and then you're so angry at everyone because of the frustration that you're in traffic and your whole day is ruined. And then when you get to the office, someone says something funny and then you're happy and that frustration is over. And then when you get to the office, you remember, oh God, I had this today to do, and you're like, so frustrated by it. So the symptoms tend to change. But then again, as the symptoms change, also the amount of pressure the environment puts on you is the one which will have these things, pop up. So in adulthood, most of the time, by the time an adult is coming to get the diagnosis, they'll not be coming in because they have ADHD. They'll be coming in because they're having issues with alcohol, issues in a relationship. They'll think they have depression or anxiety or something like that. And then when you look into a proper psychiatric evaluation, you feel, nah, you have ADHD. It's not what you think. Does it improve? Yes, with proper treatment and care, it does. Some people require meds. Some in the initial stages they do, and then over time they develop structures and systems which enable them to function without medication. Yeah.
So when you said most people come for treatment because they have a certain issue, so I came across an article that was also saying that most individuals who have ADHD tend to have a problem with drugs and substance abuse. So that is true?
Yes, that is true. That is true. People who have ADHD are very susceptible to substance use, primarily to do what is termed as self-medication. And I'm going to use a very simple analogy here. When you have a stomach upset because it was Christmas and you ate 3 chickens, four pieces, huge pieces of nyama, those huge grills. You took your pilau and biryani and mixed up Fanta, Coca-Cola, Stony. Who tells you to go get,